Thank you. I'm very happy to be able to talk to you today. Today, I'd like to talk about speech synthesis for spinal muscular atrophy based on model adaptation. First of all, I'll explain about the disease, spinal muscular atrophy. Spinal muscular atrophy, also called SMA, is a lower neuron disease caused by lesions of the motor neurons in the spinal cord. SMA is classified into four types according to the age of onset. And SMA type 1 is the most severe. Patients with SMA type 1 have dysphagia, dysphagia, and breathing problems. Study, we will focus on the speech of SMA type 1. Here, I said SMA type 1 patients have dysphagia, but how does their speech actually differ from that of normal people? And here, a spectrogram of the Japanese word ikioi for a healthy subject and a person with SMA. The left side is the spectrogram of a healthy subject, and the right side is a spectrogram of an SMA person. And now let's listen to the both speeches. First, the speech of a healthy subject, left side is
勢い
and next, the speech of a person with SMA is both speeches are uttering the same word, but as you have listened, there are quite a few differences in the utterances. When you look at the spectrograms, you can see that the duration of each phoneme is not consistent. It's not constant. In this figure, the length of the three phonemes I is not constant. Also, you can see that the power in the high frequency component is weaker than that of the healthy subject. Besides, the third to fifth phonemes I are vowel changes, and in the case of a healthy subject, the second form changes in the U shape. But in the case of SMA subjects, it does not appear. It indicates that when you listen to the speech of a person with SMA, the vowel changes is not clear. So far, I've explained the differences in speeches based on a comparison of spectrograms. And next, I'd like to look at the differences between the speech of a healthy subject and the speech of a person with SMA from isolated word recognition experiments using HMM model. Models were trained for each phoneme, and when recognizing a word, the system selected the most appropriate word from a prepared dictionary. That maps the phoneme sequence to the word. In the case of healthy subject, the ASR system achieved 100% recognition rate. On the other hand, for SMA patient, recognition accuracy was only about 15%. Although the task is relatively simple, since it's only recognizing words, it still did not recognize the speeches of a person with SMA well, because it differs significantly from that of a healthy subject. So far, we have compared the speech of a healthy person and a person with SMA based on the results of speech recognition. From the comparison of spectrograms and the ASR results, it is clear that the speech of a person with SMA differs from that of a normal person, and that it is difficult to hear the speech. Therefore, such speech becomes a barrier to communication. with people who are not familiar with SMA person speech. Since communication by speech is a variable means of communication for SMA persons, because they are unable to move their bodies freely. That it is important to create a TTS system to aid such communication. In fact, several TTS applications have been developed in recent years to support communication for people with disabilities. However, most of them are trained using only the speech of a normal person, healthy subject, whose speech is intelligible. Therefore, the synthesized speech is completely different from the speech of an actual user. In this case, a person with SMA. The SMA patient still desires to generate the voice with his or her own voice. Therefore, it is important to synthesize speeches with SMA person's identity. So one simple method that could be considered is to record the SMA person's voice and train a TTC model using only that data. However, there are several problems with this. The first is that the larger volume of recordings is too much of a burden on a SMA person. Therefore, it is desirable to train TTS model with a small amount of SMA patient speech data. Second, if training with only SMA data, their synthesized speech will be as unclear as the original speech of a SMA patient. So for TTS2 to aid in communication, intelligibility is an important, a very important factor. So it is desirable for the synthesized speech to have both individuality and intelligibility. Yes, so how can we meet these purposes? Here, we focus once on the data for healthy subjects. Then speech of a healthy person is clear. And there is a large amount of normal speech data available. And therefore, in this study, we will first train the TTS model using a large amount of data from healthy subjects, and then adapt the model using a small amount of SMA patients' own data. And now let me explain the proposed method. First, in pre-training section, healthy subject a healthy subject TTS model is created. This is the same as the general training method, where the values of the TTS model first initialize randomly. And then the model is trained with a large amount of healthy data. Then TTS model is created and output since the voice of a healthy person when text is in input. And the output speech is a very intelligible voice of a healthy person. Next, in fine-tuning section, the healthy TTS model is adapted to the TTS model for an SMA patient. First, copy the healthy subject TTS model we just created. And then proceed with training with a small amount of SMA data. In this way, a TTS is created that outputs SMA speech when text is input. Since the original TTS model, it means the model before fine-tuning, was designed to output the speech of a healthy person with high intelligibility. And so it is expected that by adjusting the adaptation where the output SMA speech will be speaker-like while retaining intelligibility. The key point here is to adjust the running rate well. and to be careful about the trade-off between individuality and intelligibility. Now, I will explain the experimental conditions. The first, I will tell about the speeches. For a healthy person, we use 503 phoneme branch sentences read by a Japanese female. For SM patient, we use 215 phoneme branch words, were read by a Japanese woman who correspond to SMA type 1. And each word was uttered 4 to 5 times repeatedly. So the number of utterances is about 1,000. And next, I will explain TTS model structure. We use two TTS model, acoustic model and a duration model. Acoustic model is estimating acoustic features, and the duration model is estimating phoneme duration. Each model is consists of three layers of the bidirectional LSTM having about 1,000 cells. Yeah. And then only the acoustic model is adapted. And word is used as the vocoder. And acoustic features consist of 60-dimensional Merkepsilon and band periodicity parameter and logarithmic fundamental frequency and voice flag. So and include dynamic features up to the scandal order, in addition to static features, except for the voice flag. So the total number of dimensions is 187. Yeah. During training, each dimension was normalized so that the means is 0 and the variance is 1. Yeah. Other condition is as described. We used two evaluation methods, a comparison of spectrograms and subjective evaluation experiments on intelligibility and individuality. And now let's move experimental results. In this section, we will compare the spectrograms of the recorded speech of SMA patient and synthesized speech by the proposed method. For the Japanese word zenshu, looking at the spectrogram, for example, let's focus on the phoneme SH. Since the phoneme SH is a fricative sound, when a healthy person pronounces it, its power is strong in the high frequency range. In the original SMA speech, the power of the high frequency component can be confirmed, but in the synthesized speech, it can be seen that there is a part where the power is strong to some extent, around 5 kHz to 6 kHz. So let's listen to the both speeches. First, the original speech is yeah, and next the synthesized speech is yeah. So as you listened, you notice that there is quite a difference between the two speeches. Thus, we can find that the synthesized voice emphasis the necessary pattern improves intelligibility. Next, we will look at the results of the subjective evaluation experiment. First is the intelligibility evaluation. 8 listeners were asked to judge which speech was clearer in an A/B test format. And the results showed that the synthesized speech was more intelligible for almost all speeches. One particular comment from the listener was consonants would be heard more clearly. It is so that the frequency components were emphasized, making them easier to hear. Second is the evaluation of individuality. 8 listeners were asked to judge whether the synthesized speech was closer to the speech of a person with SMA or to the speech of a healthy person in the form of an XAB test. The results showed that the predominant opinion was that it was closer to the it was closer to the speech of a person with SMA, approximately 60%. The proposed method achieved to synthesize a larger number of speeches that sound like those of the SMA patient. On the other hand, this experiment applied weak adaptation to ensure intelligibility, which may have had a negative effect on the individuality. Another opinion from the listener was that the easy-to-hear speech sounded like a healthy person. Here, let's listen to the Japanese word zenshu again. In the order of the recorded speech of the SMA person, the recorded speech of a normal person, and the synthesized speech using the proposed method. First, then,
前週
and synthesized speech is here. You may have different opinions to which synthesized speech is more similar to the other. In summary, this study can synthesize speech with improved intelligibility while maintaining individuality by adapting the TTS model for a healthy subject to the model for a person with SMA. As for future work, there is currently a trade-off between intelligibility and individuality. So we would like to investigate ways to resolve this issue. And we would also like to investigate methods to quantitatively evaluate intelligibility or individuality. That's all. That's all from my presentation. Thank you for your attention.
Thank you, Takuma. Any questions? Yeah, Jimmy, go ahead.
Hi, yeah, great presentation, and I think focusing on individuality is great. Oh, let me turn my video on. I guess working with people with ALS, there is a concept of voice banking, and it may be the same thing for people with SMA. Voice banking is, when you have the diagnosis on the early onset, is to record as much of your voice as possible. Before the effects of the disease kind of affect your speech. Would you have any, I guess, could you utilize some of the data preparation that you did for the typical speakers in your experiment? Could those translate in any sort of recommendation for voice banking for the individual themselves before maybe symptoms kind of affect their speech?
Voice banking is for ALS speakers. However, the SMA person type 1 is age of onset is birth for birth to 6 months. So there their perfect speech is not available. However, ALS can be used.
I see it. This is an early onset, and that's so. I guess the flip side, and sorry to take so much time, but it would for, let's say, if applying it to ALS, would this be a recommended maybe something for ALS in this case then? But thank you for that.
Yeah. So I now try to this method for ALS speaker, and then ALS speakers is also improves their speech intelligibility and individuality.
Thank you very much.
So thank you.
Vikram, you had a question.
Yeah, just a quick comment / question. I was wondering, so really nice work. I was wondering if you've thought about varying the amount of data that you use for adaptation and seeing how that affects the intelligibility versus, individuality question.
Yeah, so I try. I do not try varying some data amount of data. So, but we try to small as small as possible amount of SMS speech. So this time 215 words are used, but if we can use more words, it may be individuality is very good. However, intelligibility is maybe so. There's a individuality trade-off of individuality and intelligibility. So intelligibility is maybe down for many if we use many SMS speech.
Right. Yeah. I was just wondering where on the spectrum you want to choose, because some other work I saw at InterSpeech actually suggested that people like to listen to their own voice, even if it is not as accurate as, say, someone else's voice. So that's why I ask. So there is some point on this continuum of accuracy versus personalization that is ideal for different people. But that's why I asked the question. Thanks.